Welcome to the Fit Chicks and Hormones podcast, where I share my insight to help you move through your perimenopause and menopausal years with ease. In this podcast, I talk about natural solutions for balancing your hormones and empowering you to move away from the symptoms like fatigue, mood swings, hot flashes, and resistant weight loss to feeling vibrant, confident, and full of energy as you age gracefully. Let's get started. Welcome to the Fit Chicks and Hormones podcast. I am so excited to have a guest with me today, Shelly Beckley of Brio Health and Wellness. And we met about a month ago. It's been about a month, a little over a month. And she reached out to me. We met for coffee and we hit it off. And it's been so nice to have somebody to connect with that has the same passion for helping menopausal women as I do. So welcome, Shelly. It's so great to have you here.
Thank you. I'm excited to be here.
That's awesome. Okay, well, let's just start by letting everyone know about you. Like, share a bit about your background, what led you to start Brio Health and Wellness, because that's a very interesting story. I loved it.
Absolutely. I am a nurse practitioner and I have been in medicine for over 20 years and as a nurse practitioner for between 14 and 15. And the majority of that, I have worked in academic medicine, in oncology, treating a lot of breast cancer patients. And during that time, we are knocking people into early menopause and wiping out their hormones, and then seeing them in follow-up, and just how much they struggled. And it's been interesting over the years and seeing what we can offer them as far as different types of hormones. And, it used to be in the early 2000s. I'm sorry, we got nothing. Here's some grapeseed extract. Here's, an SSRI. Let's see how you manage it. And now it's changed to, well, we can do some vaginal estrogen. We can do different things. But really just seeing them, every 3 to 6 months and getting this relationship with them and following them through their struggles of what the hormone changes has done, even more than what the cancer has done to their bodies. And so then, I went through perimenopause myself, and I think that you never truly understand until you walk in somebody's shoes and trying to find care. I started having all of these symptoms in my early 40s and, nobody listening to me and everybody, you're fine, you're crazy, you're not really feeling like this. No, it was like, no, somebody has to listen to me because this is not myself. And then finding somebody that did and the care that I needed, I was just like, I have to offer this to everybody and, educate women that we don't need to suffer and that this is real. And then just kind of diving into the science behind it and learning more about it. And I got my Menopause Society certification. And just, the goal of Brio is to meet women wherever they are at. And whether you come to me or not, I just want to educate women.
Yep. I love that. Yes. And that's why I think we hit it off so well, because exactly that's what I'm like. I just want to help these women and let them know you don't have to feel that way. This isn't how it's meant to be.
Yeah, exactly.
You got a lot of life to live. We don't want to live it like this. So there's plenty that you can do. Yeah. So I think that's great. I want to just go back to the breast cancer part of it, because I've had many clients come through our doors, that have had that, and they've got the same answer, like, because they're like, oh, now I have all these hot flashes, I feel awful and everything, and the doctor's like, well, you can't take anything. And so it's so nice when we had the conversation, I was like, oh, there are things that they can do, because again, why is it that women should have to suffer at all when there's so many other things that you can do?
Yeah, I think it's worth a conversation. And, it's also been interesting just kind of in my practice, seeing the conversations we have for men are completely different than the conversations we have for women. And I think it no longer should be a no before we even talk about it. I think that there needs to be a conversation, and women are very intelligent and we can make that decision ourselves on the risks and benefits. And is this worth it to me? I mean, quality of life is what it's about. And so if we can't improve somebody's quality of life, what are we doing?
Right. Right. Yeah. again, it's so, so true. So true. Um, what So at through your journey, because again, that's how I came into this, is because I was going through perimenopause and I was like, what? This is not me. Why is this happening? And I was also exposed to mold, so that kind of like spurred everything. But
Mhm.
that's how my journey started. And I feel that at that time when I was like, nobody's explaining me. They're just like, oh, this is off and that's off, and you need to do this and this. It's like, but I'm always like a 3-year-old. But why?
Yeah.
Why? Why is this happening? And again, that's the part of the education that I love doing, and I love that you want to do as well. So with your journey, what do you feel like it is the most that women they're struggling with and that they don't really understand, or they don't know they're like, I just don't understand what this is, and what do you do to help explain that to them?
That's a great question, and I feel like every woman is different in their journey and their symptoms and what's going on. I think that symptoms can start in our early 30s, and that's really truly when we hit a block with the conventional medical system, is because you're too young for this. This shouldn't be going on, and I think that at that point, if a woman is in their early, mid, even late 30s, there's definitely a workup that we need to do to let's make sure that something else isn't going on. Let's, dive into lab work and different things. But if we find that everything is normal and they are having these symptoms, and they could be symptoms like heart palpitations, all of a sudden they're having panic attacks, all of these things, nothing in their life is different. And now they're having all of these side effects. Then we need to have the conversation of, well, it could absolutely be your hormones that are off. Because during the mid 20s to early 30s, most women's menstrual cycle is just this beautiful system of rolling hills with all of our hormones, and everything is working wonderfully, and the brain and the ovaries are talking, and we're releasing follicles, and all of this stuff is happening. But when it gets off, it is a mad roller coaster of hormones, and in the same 24-hour span you could have peaks of estrogen levels followed by complete plateaus, and that's what makes us feel like we're going crazy, and that's what gives us all the symptoms. And so I think just educating women on, you know we absolutely should do a cardiac workup to make sure we're not missing anything. But then let's talk about hormones and what's going on, and why, some testing is needed and other testing might not be needed, and what needs to be done to really make you start feeling better. And again, everybody is different. So the journey is going to look different for everyone.
Yeah, and we've discussed that a lot, how everybody is so different. Like you can't treat one person the same as somebody else because so many different things are going on. And that's what I want women to be aware of. Like if your story looks different than somebody, don't think something's wrong with you.
Exactly.
Yeah,
Yes.
like talk to somebody about it for one, talk to somebody that will listen, or learn more about it, and figure out what's going on and see what path to go down. I know we've also talked about how, because I think I see a lot of this all the time, like if I could just get on hormones, I'd feel better. People are like,
Yes.
if I could just get the hormones, my doctor would just give me them, I know that everything I'd lose the weight, I'd feel good. It's not the way that it's meant
Not
to
that
be.
easy. Yeah.
Not that easy.
Unfortunately, it's not
No,
that easy.
because you have to start with what's going on with the body first, like the lifestyle. Like if you are eating horribly and you're stressed out all the time, you're not sleeping, like hormones are not going to, they may like take the edge off a little bit. And I'm speaking from experience. Like I thought all this was going to be the magic fix, right? Not so much. You have to do all the other things too. So when it comes to that, how do you explain that to women? Because I'm sure they're probably like, I just want this, give me this, it's like everybody wants the magic pill because it's
Yes.
easy.
Yeah.
Like how do you explain that to women, like this, that's not where we need to go first because of this reason or whatever?
So I like to take things slow. I like to start with maybe a lower prescription of medicine if medicine is needed, and go slowly. Because I feel like if we are throwing the book at somebody, we are not going to know what side effects come from. We're not going to know what's working, and so if we start and then we build upon that, that's when we truly can make something that's lasting, that can get women to feeling their best. And absolutely, it includes eating healthy, exercise, stress management, all the things that is easy to talk about, but when implementation comes into place, it's like, I don't have time for that. And I think that one part of going through this midlife, process where we're at, we have to make time, because that's truly when we're going to see the greatest health changes, is when we start to implement the mind and the body, and then medications if they're needed. And we are very complicated beings, and it takes part of everything to make things work.
Yeah, I agree. I agree. I think that's one of the biggest obstacles that I have with women is saying like, yes, I know you got a million things going on. I understand that, but when's the last time that you just stopped and did something for you?
Yeah.
Right.
Yeah.
And getting but once I get them on the other side of that, they're like, oh my gosh, I can do all the things and I can do it better now. I'm like, yes,
Mhm.
because you're taking care of your body first.
Yep.
Yeah.
And it's the saying, you have to fill up your own cup before you can pour it out for others. And I think that women are very quick to put guilt on ourselves. I can't take time off for myself because I have all of these other things. But truly, if and it doesn't need to be 5 hours a day that I'm just putting on myself. It's, let's take 15 minutes, let's take 30 minutes and do whatever works for me, and try to fill my cup a little bit. And then it really does go so far.
Yeah, that's kind of what I do with my clients is like, you know what, if you do 1% better, something change 1% more, or if you take 10 minutes for yourself every single day, it's gonna add up and you're gonna notice a huge difference in everything just by
Yeah.
doing because you're taking time for you. Yeah. So that's huge, huge.
Yeah, I agree.
Yeah. So let's talk about first of all, like, what do you find that most women, what are they coming to see you for? Like, where are they at? I mean, there could be, a whole bunch of things, right? So, but maybe there's something that, this is what I find a lot of what's going on that women are like struggling with or they're frustrated with, and that they come to you. And then, what do you do with them when they come to you?
That's a great question. So I think, the first symptom that everybody thinks about when they think about perimenopause or menopause, hot flashes and night sweats. And that's like the number one thing. And when people go to, their provider and are like, oh, I need help, a lot of times things are dismissed if we don't have those symptoms. And those are vasomotor symptoms, that if we don't have those, you are not in menopause. And it's interesting because the majority of women don't come to me with those things. Typically it's anxiety and depression and, panic attacks. And I'm screaming at my kids and my family, and I don't want to be in this marriage anymore. And my libido has tanked, and, I'm starting to gain weight, and just miserable. And it doesn't have anything to do with the typical hot flashes and night sweats. And so usually, we take a step back. And the reason that I have my model of care the way it is, whereas I don't accept insurance, is that I want to be able to sit down with a woman and spend as long as we need to in the beginning to understand somebody's story, to understand what they're coming from and what their goal is. I don't just want to know your symptoms, because when you come to me with symptoms, I can have an answer for you, but the symptoms that I see, you might not care about. You
Right.
might say, oh, I have a low libido and I haven't had sex in years. And so to me, I'm like, oh, let's talk about that. Whereas in a conversation, you might be, I don't care about that. Like, that doesn't bother me. And so let's fix these other things. And so
Like, I need to have the energy to live first before I can think about sex. Yeah.
exactly,
Yeah.
exactly. And so, or somebody is just not sleeping well, and, you know, somebody came to me and they weren't sleeping. Well, come to find out, they were waking up 6 times a night to pee.
Oh
And
God.
it's like, just kind of teasing the information out and figuring what we can do and what we can fix. And everything is not a medication, and truly being holistic along with trying to figure out if medication is needed. That's the journey that I want women to go through. It's to, feel like somebody's actually listening to them, not just trying to fix their symptoms, but let's create a plan you can live by that you can actually start to do yourself and feel better. And then you're not going to need me.
Right. That's what I like. Creating the lifestyle plan. That's what I always tell my clients. We're creating a lifestyle for you that works. So you don't need, right?
Yeah.
Yeah, because when they come to you and they're like, I have no idea what to do. So let's figure this out. I want to just go backtrack just a little bit because I think that this is where a lot of women, when they are experiencing what you said, like their mood swings and they're sad and they're happy and they're like they go to the regular doctor and then they just put them on some type of depression medication. And I'm not saying that's not always necessary, but
Right.
it's not the fix. And again, that's because they just listen to what you have and let's just do this. And that's what I love about you is that let's have a more of a conversation to figure out what's going on and not just put you on something because I feel like everybody wants a pill to make something better. But you
Yeah.
have to get to the root cause. Like, what is causing it? Why is it happening? What is going on in your life? It could be so many different things. And if
Yeah.
you're just putting a band-aid on top of it, it's never going to truly be better. And you're never going to live your lifestyle, your life the way that you are truly meant to, right?
Mhm.
Yeah. So,
Exactly.
yeah. So I love that. That's awesome.
Thank
Um,
you.
yeah. Cause I'm like, let's do everything natural first. And then if we need to go somewhere else, then we will.
Mhm.
Do you do any type of like labs and assessments and things like that when people come in? I mean, I can share my experience too, but you go ahead and go let us know.
So if it's needed, absolutely. Or if somebody wants to, see what their lab work looks like, sure, let's go ahead and do it. Do I think it's necessary for everybody? Absolutely not. I think that it can be an increased cost. And the other thing I want to make sure is I'm not telling somebody to spend all of this money when it's not needed. And so I don't think lab work is always needed. Sometimes it is, but my other just desire to get the information out there is the goal of treatment, if we do treat with hormone therapy, is not to get hormones back to pre-menopause. We don't need to get somebody's hormone levels back to what they were in the 30s. And
Right.
so if somebody is telling you that, that is not correct. And, getting somebody to come back and taking lots of lab work while they're on hormone therapy and trying to make sure that your estrogen levels are between this and your progesterone, that's not needed. Um, and, do some people require that? Sure, for different reasons. But if it's truly because we're treating perimenopause or menopause symptoms, lab work is not needed. Now,
Right.
if we're looking at other things, if we, some of the same symptoms for thyroid disease can mimic perimenopause and menopause symptoms. So we need to make sure your thyroid is normal. We need to make sure, how are you functioning with your A1C and different things like that to make sure that we're down the right path. But the other thing is one of the huge symptoms for women going through this is weight gain and the word that I cannot say right now.
It's okay.
Yes, thank you. Visceral fat. So fat in our belly. One of the things that I do like to measure is body composition and metabolic rate because, truly when we go through this transition, our body has estrogen receptors everywhere. And when our estrogen levels decline, inflammation increases. And when inflammation increases, it can cause our cholesterol levels to increase, our blood pressure to increase, our metabolism kind of crashes, and we get fat deposits in places we never had them. And so doing some of these testing with the metabolic rates and the body composition truly allows us to make a plan for a patient that you can start changing some of these things. You can know exactly how many calories you need to eat, what kind of exercising you need to do, and it's just more personalized and directed for women.
Yeah. And me as a person, that's why I like to know why. And I like to see proof. And I like, I like the testing because I'm like, okay, this is, I kind of am back, or not backwards, but I'll look at the testing and be like, oh, this makes sense now why I'm experiencing this, right? Or like you said, the in-body, the metabolic testing and the body composition testing. It's like, okay, good. This gives me a good idea of where I need to focus, what I need to work on. And it must be this the coach in me, but I want to see progress. Like, what can I see
Yeah.
happen? How can I see these trends change and get better? And instead of just like feeling like, again, I like goal oriented things. I want to see something happen and strive for something. So with all of those tools that you have, I think that's great because that gives women that are just like me that, oh, I have something to work towards. Great. I love seeing this because this will tell me, or they look at it like, oh, okay, I have some work to do. Instead of us just saying, this is what we're doing, it's like, this is why you're doing it. It's right here. It's, to show you. So I think there's a couple different ways to look at all those things that you use,
Mhm.
and how women would use them, right?
Yeah, and I think, the good thing is over time we can follow it and we can see your progress and things to change. And it can be highly motivating for somebody to see that on paper. And the other part, when we're doing metabolic testing and we're saying, this is the caloric intake you need just at baseline, not even to change anything. The vast majority of women are like, oh, I'm not getting anywhere near those calories.
Yep.
And it's like,
Yep.
mind change. We have to feed our bodies to get results. We can't starve our bodies and expect it to do anything for us. And so I think that having that in front of you, being able to read that is really eye-opening.
Yeah, I agree. That's again one of the biggest struggles I have is getting women to eat. I'm like, I love food. I don't have a problem eating food, but when they're like, I'm eating so much, I'm like, but you're really not, and this is where you need to be. And that changing that mindset, I think, is one of the hardest things when it comes to women.
Oh, absolutely.
So, like you said, having that tool, like this is what you need to eat to just live your life. So
Yes.
you're not eating that, so that's probably why your body's not feeling so great. So let's work on that. Yeah, yeah.
Yeah. Yeah.
I want to go back to because I think you mentioned like giving yourself grace because I think this is the biggest struggle that women. I know it is for the women that I work in their early 50s, 60s. They feel like they're doing everything right. And they probably are doing everything right, but they're
Mhm.
just not feeling like they're making the progress um, the way that they should. But they have a million things going on. Like in this that age demographic, life is so different. You may have
Yeah.
younger kids, you may have older parents that you're taking care of everyone. You're also you have a job and you have a husband or a significant other, whatever it may be. Like there's so many things, and I try to express the fact that you're doing what you can right now, so give yourself grace.
Yeah.
What would you give to someone that comes in and feels like I'm doing everything right, nothing's changing, like, but knowing, progress it's not just on that scale.
Yeah. I say the exact same thing. My first thing is that give yourself grace, take a breath, realize how much you're doing. I don't think that women in general are good at that. I think that we hold everything on our shoulders. And it's very hard for me, for sure, to be able to offload and give other people things to do. It's hard. And so, when we think about what's going on, a lot of women who are doing this are continually stressed. Their stress level is just at a high rate. And so I think sitting down and explaining when you are doing this and when you're so stressed out, your cortisol level is going crazy and then you're in this fight or flight consistently. And when that happens and your body has such a high level of this cortisol that, you are going to have decreased metabolism, it's going to make it very difficult to have your blood glucose level be where it should. You're going to have a decreased immunity. It can cause all of these things. And so I think sitting down and explaining everything that's happening and then using some of these tools to look at, let's look at how you're eating, let's break things apart, but also explaining that long-term solutions take a long time to get there. And
Yep.
that You don't need to make the change overnight. And, you are there for these women. I am there for these women, and we're not going anywhere. And so just taking the time to create a sustainable plan, that's, I think, what's frustrating with some of these diets are, I have seen lots of women go on these diets, the paleo diet or, whatever, and they do amazing. And then they come off of it and they gain everything back and they start feeling like crap, and it's like, well, we need something that's sustainable for you. I don't believe in diets. I believe in finding something that works for everybody. Because it's out there, it will take a while to get there, but you know giving yourself grace is a huge part of it. And maybe you don't have time to put in for exercise, and maybe you do have to eat fast food because that's where we're at in our life. Let's make some good choices in the fast food. And let's park at the back of wherever we're going and get a few more steps in to walk there. And there's just very small things that we can do that over time, it's going to make a difference.
Right.
And I think that also realizing that we are aging and we are never going to look like what we did in our 20s and 30s. It's just not going to happen. We likely are not going to weigh the same. And even if we did, our bodies are going to be different.
Right.
We don't have the collagen, we don't have the muscle mass, and giving ourselves grace to age is very difficult in our society. And I think that needs to be part of the conversation too, of we don't need to be perfect and we don't need to look perfect.
Right. Yeah. I love that. So true. I think for myself, that's been the hardest part is I've came to finally, it's taken me years to get to the point where I don't care about the scale. So wish every woman throw away the scale. I wish they just would. Right. So that number doesn't mean anything to me. But when I look in the mirror and I see all the wrinkles and I'm like, what's happening here? That's the hardest. I'm like, I can't change that.
Yeah,
That's just aging. So that's been harder for me than, okay, my weight's not moving, but wow, I'm getting wrinkles and I'm forgetting things and have the gray hair. Just that part of aging for me has been more difficult. So what I've done is shift my focus. I'm getting stronger, I'm building muscle. And this is
yeah,
what I ask my clients, like, okay, I know you're not seeing the progress that you want, but tell me, how is your energy? Is your sleep better? Are you
yes,
doing more that you did before? Do you have, whatever, is your digestion better? Do you feel better when you eat more food? Like those things are progress. It's not
yes,
just the weight, and it's progress, right? If
mhm,
you are not exactly where you were when you started, you're making progress.
exactly,
Something
exactly.
changing.
Yeah, and it is hard. It's hard to, we have this idea of who we are in our head and then looking in the mirror and being like, what has happened? And it's super difficult. And I think it's difficult for all of us. But, it's part of it. And it's a blessing that we get to be here and we get to see all of these wrinkles that we have in my gray hair that I cannot stand. And, it's unfortunate because it's hard to go through, but it's a blessing and it's a mind shift that we need to do that I am not good at. And so I will be the first one to say how hard it is.
Yeah.
But I also think that we need to do things to set us up for success. I know lots of people that will buy clothes a size smaller because that's the motivation to be able to fit into those clothes. And then they have thousands of dollars of clothes sitting in their closet. And it's like, that's not motivation. That's dragging you down because now you get frustrated that
Yep.
you can't fit into these clothes. And so then you don't care. And then you start to eat like crap. And, let's do things to set ourselves up for success.
Yeah. Yeah. Yeah, I love that. I love that for sure. That's awesome. Okay. So you did also mention like the functional medicine part, holistic part of what you do, right?
Mhm.
And I think some people, I know when I first learned about what holistic medicine one was, I was like, it seems a little different to me. Because you're used to going to your medical doctor. You're used to, so if you were to explain like what the differences you feel are, because you've went from both sides, right? Um and then how it would be different for somebody coming in to you versus a regular doctor. I think you kind of explained a little bit, but just a little bit more so people can understand what exactly it is when it's more holistic.
Yeah, I think that there should be a good mix of Eastern and Western medicine, and I have always believed that. I don't think it should just be one or the other. Um, some things I think will work for some people and not so much for others, but I am, especially for things like weight loss and struggles with fitting into clothes and working out and losing muscle mass. I am a huge proponent of looking at the why and not just saying, okay, well, let's go right to a GLP-1. Let's go right to weight loss medicine. Is there cases where that's recommended? Absolutely. If somebody is obese and on medicines for cholesterol and hypertension and have all of these comorbid diseases, yes, let's drop the weight, and then once you get down, let's start looking at things. That's not the case for everyone, and so what I'm seeing happen now is that women and men who maybe just need to drop 5 pounds are wanting to do these weight loss medicines because you don't want to put the work in behind it. And I mean, everybody has their own opinion on this, but I truly believe to have lasting results and success, again, let's go back and look at the metabolism, what you're doing. Let's look at the body composition. Let's look at how your body monitors glucose. There's glucose monitors that you can wear for 2 weeks. That let's look at what happens to your blood glucose when you sleep, when you exercise, when you eat different things. And then let's try to make little changes so you can start working on yourself and not needing the medicines to do it. And it doesn't have to be difficult. And, I know that people always think, well, what's the cost going to be for me to be able to buy the fruits and vegetables? Because yeah, they're expensive, but look long term. Is it going to be cheaper to do that versus to now have to need all of these medications that you're going to have to do to reduce the cholesterol levels, to reduce the hypertension?
Or
Again,
in the hospital with a bunch of hospital bills. That's what I
yeah.
always say. Yeah, that's
Yeah. So I think that, that the part of holistic care that I love is looking at the whole body, looking at what we can do to make sure that people are at their best and aging gracefully.
And I feel like there's so many more people that are open to that now than there used to be, which is
Yes.
great. And I think it's just getting the word out. Like this is good. And if you want to fix your overall health and not just take a pill and make yourself feel better for a little bit or not even maybe, like let's work on all of it. And so, yeah, I think that's great. And again, having more of them, there's more out there. They're more, you hear about them more.
Yeah.
It's great. And I absolutely love what you're doing. I love that you created a practice out of this, out of your experience from working with women um, that were just struggling, that were just thinking that they didn't have anywhere to go. They didn't have any, they didn't have any, they couldn't get better. They couldn't feel better. So
Yeah.
I think
Yeah.
that's great.
I think that, we also need to be careful because there are some purely holistic practices that some women are on thousands of dollars of supplements every year. And so we need to definitely look at things both ways, but I do think there's a benefit to both sides.
Yeah. Yeah. And I will always go back, like, let's work on the basic things that you have control over, what you put in your mouth, how you move your body, right? Those two things right there, how you manage your stress and get good sleep, like those four pillars,
Mhm.
focus, those should be your main focus before anything else.
Yeah,
'Cause
absolutely.
changing those could affect so many things where you don't need anything else.
Yeah.
That's all you need, right?
Yep, absolutely.
Yeah. All right. So one last question. If you could give every woman over 40 one piece of advice, what would that be?
That's a great question. Advocate for yourself. Um, that is something that I have learned through, lots of different things that have happened to myself. And it's a skill. And if I could teach anybody anything, it's that you need to be heard. You have things going on that nobody else is going to understand except for you. And if you don't find that you are finding the care that you deserve, you need to advocate for yourself and you need to find somebody who will help you, because there are lots of us out there, especially now, that will absolutely help. But I just don't want anybody to feel like the doors are closing in their face and that there's nowhere to go, because there will always be somewhere to go.
Yes, yes. And that's why I love by doing these podcasts, because every little piece of information or education we get out to more women that can hear it, then it's going in their head. Like when they go to someone and they don't listen, they, instead of them thinking there's something wrong with me, no, this isn't right. I know my body better than you do, and I know something's not right. So we need to get to the bottom of it. So yeah, find somebody that will listen, because they're out there. You just got to keep
They're
looking.
out there.
Yeah, they're out there. Yes. Awesome. Okay. So if somebody wants to learn more about you, check you out, where can they go? What can they do to do such a thing?
Yeah, absolutely. So go to my website. It's briohw.com, briohw.com. You'll be able to learn more about me, more about the services I provide, schedule an appointment. And then, it has the contact information. You can always email info@briohw with any questions. And I'm happy to help anybody and guide anybody to get them in their best health.
Yes. And I absolutely love that. I love that. And I will put all that in the show notes. So if people just want to click on that link to check you out, they can.
So
So thank you so much. I appreciate you so much. I'm so glad we connected. I can't wait for us to collaborate and work more together, and even do more of these. Maybe we'll do some more specific podcasts on information that women they want to know more about, because it'd be fun to do a back and forth kind of thing. So
yeah,
yeah.
absolutely. Well, thank you so much for having me. I love working with you, and you're just doing amazing things for women. So I love
Oh,
it.
well, thank you so much. And again, thank you for taking the time. Have a great rest of your day.
Thanks, you too. Take
Thank
care.
you. Bye-bye. I hope this episode today resonated with you. And if it did, I would love for you to share it on your stories and tag me on Instagram or Facebook. A review would be appreciated too. Your reviews and shares not only help us to grow, but they give other women who are struggling through their menopausal years hope that they don't have to continue living the way that they do. Your questions and experiences are also so helpful in giving me subjects to talk about. So feel free to reach out to me anytime on Facebook or Instagram with anything. I would love to help.